Hello, everyone. I'm Dr. Leon Caldwell, Senior Director of Health Equity Strategies and Innovation at the American Hospital Association's Institute for Diversity and Health Equity. I'm pleased to join you all. I'm also very excited to introduce or have my team members introduce themselves as part of IFDHE's, really our collaborative, if you will, to support our members in this very important award, one of our signature awards for the American Hospital Association. So I would like to have our team members at Institute for Diversity and Health Equity introduce themselves really quickly.
Hi, everyone. My name is Ogechi Amacheba. As you can see on my screen, it says Joy Lewis. I am not Joy Lewis, but I am instead Ogechi, and I am the Senior Comm Specialist for IFDHE.
Good afternoon or good morning, wherever you are. My name is Krista Meekins, and I am the Program Manager for Health Equity Strategies with IFDHE.
Excellent. So we have are very fortunate to have with us as well our previous winners and runner-ups of the Carolyn Boone Equity of Care Award. This is really a prestigious award, and we're honored to have our current award members or awardee and runner-up awardees present today to really give us a sense of health equity in this big sense and how it works in systems and what we see as kind of innovative work that advances equity. We'll just ask you all to just give a brief introduction. I think I see Joy there as well, or is that the real Joy? Is that Ogechi? Okay, that's Ogechi.
It's just me, yes.
Okay. If the real Joy is out there, we'd love to have our Senior Vice President for Health Equity Strategies chime in. She may or may not be floating around here. At this point, if we could have our kind of honorees just give a brief introduction.
Hi there, my name is Dr. Cherie Gregory. I am Senior Vice President and Chief Health Equity Officer at Novant Health. I've been at Novant Health since 2004 and really privileged to be here with you today.
Thank you.
Hi, I'm Dr. Brooks. I'm Chief Medical Officer for Center City at Thomas Jefferson University Hospitals and also the Executive Vice President and Chief Community Health Equity Officer. Jefferson.
Great.
And I'm Pam Abner, and I'm the Vice President and Chief Diversity Operations Officer at Mount Sinai Health System in New York. And likewise, I'm pleased to be here to speak with you today.
Great. Thank you all for your hard work, and thank you all for really committing some time to share with the field the work that you've done and really hopefully inspire others not only to advance health equity, but to apply for the Equity of Care Award. One and say before we get started, you'll notice in this year's application process, which will be launched on September 26th, we've changed the award to be more equitable, if you will. And when I say what does that mean, we noticed over the past several years that the award has taken on really opportunities for larger systems, hospital systems. And we didn't see where we were incentivizing or finding room for smaller systems or even rural hospitals to really get engaged in this work. We think these awards are really important. We think acknowledging good work across the systems that and hospitals that make up our membership is really important. And what we didn't want to do was create an award process that really didn't reward or recognize, if you will, the wide range of membership and have the opportunity for the wide range of membership to see themselves as advancing equity where they are. So we're excited about the changes we've made. We think this is going to be like a really good thing for our members and the field to have a wider range of categories for which we'll talk more about a little later. This idea that we have of advancing equity with the health equity roadmap is really important. It's important to us, it's important to the country, it's important to communities. And our investment in the roadmap, along with the Robert Wood Johnson Foundation, really is a pinnacle, or really a catalyst, if you will, to how hospitals and communities and their governance structures and operations, all the components, workforce, how they will see themselves or position themselves to advance equity, not just in patient care and safety, but across entire systems and all aspects of hospitals. So we're really excited to make this connection between the health equity roadmap and the work that you all are doing in the awards. So I'm gonna pivot to what we're calling our Fireside Chat with the awardees or recipients of the award from 2022. And I'm really excited about this conversation. I will say in our tenure here at AHA, this is the first we've done this. So we're excited to be able to have a conversation with those who previously won, to hopefully inspire others to apply and to continue the good works. So let me just start with a question that we've had. I'm going to ask each of our guests to kind of chime in on this question. I'll start with Dr. Brooks. So what sparked your organization's decision to actually apply for the Equity of Care Awards?
The president of our Thomas Jefferson University Hospital Center City is actually, a very active member of AHA, and he is part of the Diversity, Equity, and Inclusion Committee, and it came across his desk, and he was familiar with a lot of the work that I had been leading related to the Jefferson Collaborative for Health Equity, and some of the work that we've been doing with regard diversity and equity in terms of hiring practices and monitoring our leadership statistics. And so it was on that basis that he suggested that we consider applying. So that was suggesting and following up on that suggestion.
What about you? Tell me more about Mount Sinai's decision.
Hi, thank you, Dr. Caldwell. So, we've had at Mount Sinai a longstanding focus on diversity, equity, and inclusion in the organization, and we've been doing a lot of work over the years to further instill that and advance the emphasis on addressing disparities and inequities in our communities. So, and I'll just say this quite honestly, we like to, be recognized for that which we do, right? So, everyone knows, the culmination of a lot of things, particularly around George Floyd's murder, COVID, and Black Lives Matter. A lot of emphasis shifted towards what's going on in marginalized populations and such. And we were fortunately well positioned to respond and have data and do a lot of work and analysis to help us to really start to look more deeply at what was happening. So we wanted to just really share that and reflect upon that. And that was the impetus. It was really, from our Office of Diversity and Inclusion, with support of leadership and others in the organization as well. Our CEO and our hospital leads, we thought this was an important thing for us to share with others.
Thank you. Dr. Gregory.
I think I can dovetail on that. So one of the things that we realize is that we're across a 3-state footprint and have over 30,000 team members and many venues of care. So that basically means as the Chief Health Equity Officer, it's not just my job to do health equity. We want it to be embedded across the entire organization. So we are always looking for applications or accreditations that help us to really get an inside look at us. The other way that I share this is that it's our opportunity to identify all the great work that's happening across the organization that I don't even sometimes hear about until we do some of these applications. And then it's a real opportunity for people to celebrate. We really want people to see themselves in health equity, even if they aren't patient facing. I think that's one of the biggest things that we highlight at Novant Health is every time you come to work, the work that you do somehow advances our goal. And so when we put out this application and ask senior leaders across the organization, share with us your perspectives on how you've contributed in some way to some of this really important work that we're doing. We get a lot of feedback from people that say, we didn't even realize how impactful our work was. And so it's recognition from an organization like yours. And it's also just sort of internal recognition and celebration for some of the really great work that our folks are doing around the system.
Great, that's awesome. Yeah, it is really important. And one of the things we talk about is, these awards often incentivize the behaviors we want, right? And I think the ability to celebrate is really important, particularly the last couple years where it's been really hard and challenging for many of our members with all of both the complexity of delivering healthcare as well as what's been going on in our systems in many of our cities and towns. Another question we have is like, so when you started to put your application together, right? What's team members had to be around the table? Like, can you talk a little bit about like, how you did this? Like, what's the mechanics of it? How about you, Dr. Gregory? Can you talk about Novant's process?
So lots of people involved. I think we start with our Senior Director of Ops and Performance for Health Equity, and we also have a Senior Execution Manager, Strategy Execution Manager, who are kind of like my keepers of the work that we think we know is going on, to pull together ideas that we then share across the organization. When we think about health equity, a lot of our goals are both annual and long-term goals and constantly ongoing. So we have a number of work streams around the health equity that we do in our acute care facilities, the health equity that we do in our ambulatory care centers, and then that crosswalk. So for instance, we have a long-term goal for heart failure around readmission and mortality. So it's inside and outside of our acute care facilities. Each of those goals have work streams. So we pull together our work stream leaders across the system to talk about where we are. It's one of our moments to evaluate best practice, see where we have opportunities. And then we always say, for the next application, we're hoping that we'll be able to say that we have accomplished this next thing. And so it's really just the thought partners. And we also have patient advisory councils where we get the opportunity to say, hey, have we gotten this right? If you wanted us to share something about your experience and something that we've done, what would you want us to share? So it's really a fairly big endeavor with lots of folks and voices at the table.
Nice. How about you, Pam? What was your process like?
Very similar. We speak to our colleagues throughout the entire organization. Our Office for Diversity and Inclusion, we, actually gather that information and submit it. But what we also do is we kind of have this ongoing repository of information because, in addition to, AHA, we participate in other surveys and respond to other, whether it's a grant or writing articles or other areas or surveys. So we keep this information kind of at the ready, if I can say it that way. And we continually have conversations with our leaders and others in the organization in various areas. So for example, our Quality Leadership Council does a lot of work around advancing equity and addressing using specific patient data to look at disparities. So we have information about that process. We speak to, work that we're doing at all levels of the organization, right? To make sure that we have that ready so that we could easily respond. So it almost comes down to not a cut and paste, but we have things developed. So it's we have an ongoing journal, I would say. And we have those continuing conversations with leaders and colleagues. And, again, focusing on work that's happening within the organization, within our communities. We have that community focus, what we're doing to advance learning and education and understanding equity and what that means to individuals. That was really key in terms of the work that we do as well. So that was part of the process, how we, in terms of what we want to make sure we have available and share. So I would just say that, it's housed within the Office for Diversity and Inclusion in terms of the responsibility for bringing it all together. But the work gets done, as Dr. Gregory said, it gets done throughout the whole organization. Obviously, we don't do everything from our office, but we connect, we help, and we guide, and then we gather that information.
That's great. It almost sounds like a similar process for when our members are doing the health equity roadmap, right? When they start that process of getting everybody together, really doing a diagnostic, if you will, to some extent, an assessment to seeing where they are. And then, what's the progress on the equity? And as you kind of put that together, this application then becomes much easier, right? Because you've already started to do the work.
But we have a strategic focus and plan. So we have kind of areas of focus for our DE&I work. And you're absolutely right. By having that, and then you're always gathering, where are we in this process? What have we done? The information's there. So it wasn't so hard for us to go out and to fill in the blanks. We kind of have that as an ongoing work since we established our strategy. And I always say that, it's important to make sure you have a strategic plan for your DE&I efforts, and then just kind of track those. And then you just pull from that to respond to surveys and such.
Great. Dr. Brooks, is that kind of where you all landed, or you're a similar process, or did you have something different?
Yeah, I mean, I think we had not previously applied for a similar award. So we sort of had an initial discussion about, once we reviewed the questions, what types of areas that we should highlight. We worked with our HR team, diversity, equity, inclusion, PR, marketing. I, did give a presentation to our strategic leadership council to make them aware of it, so that if there were things that were happening that I may not have known about it, that we would be able to include it. And we set multiple deadlines in order to get the information. And then we had a process to sort of verify the information once we had collated it in time for the submission. And I think to echo what everyone else has said, these awards are not an endpoint, clearly, but they do make a huge statement, and they are really helpful to help focus the attention of the organization of the things that are going on to move the needle. So I can just say, I'm very grateful to have the opportunity to participate in this, and to sort of have that recognition helps us. It makes it easier for us to do the work.
Yeah. Yeah, I like the comment around these awards are not the endpoint, right? Yeah. For many places, the process of applying is part of the gathering of information, the assessment, and then, the award or being recognized or going through that process, that in itself can be rewarding for many organizations, because they hadn't really thought about or done these things before, collected data, or even thinking about the roadmap in a particular way that then sets them up for the next wave of work. So it's an interesting concept to think about the awards, or to remind yourselves that the awards are not the endpoint. They're just part of the process along the way. Speaking of the process of putting an application together, can you all tell how and was the communities that you serve, how are they engaged, if any way, in the application process? Pam, you want to talk a little bit about Mount Sinai?
Sure. So I want to say probably not so directly in the application process. However, a lot of the information that we have, we do engage with our community. So it was like a not directly, but indirectly, yes. So we do a lot when we think about patient experience, or even how we gathered patient demographic information. We've done a lot where we have brought the community in, or we have focus groups discuss with them certain aspects of the work that we do. And that then got reflected in how we responded to some of the specific questions, very much so as it relates to demographic information, what makes our community members or prospective patients or patient population comfortable in sharing information with us and data. And as you know, I don't have to tell anyone how important it is to accurately reflect demographic information about our patients. So yes, we brought the community in that regard. Also, as it relates to if we're looking at other programs and other initiatives that we have within our communities around education and talent and building talent pipelines. So again, we work a lot within our communities to hear their concerns, their voices, and helps us to kind of frame those programs and services that we develop together with the community, right? So I wouldn't say that we're sitting down with the application, but we know that we have that community perspective in terms of the work that we do, and then how we then respond in terms of who we are and where we are. And again, you know, just to go back to your other point, it's not, you know, this is ongoing that it's ongoing that we update our information, but I think it's really important that to have these types of surveys and questions kind of keeps organizations on their toes, because we say, what is it that we're expected to do? So, right, to go back to, I think it was Dr. Brooks who made that point. It's good to have these things kind of as a tool as a way to check in. Are we doing those things and asking the right questions and positioning our work the way that we should? So I personally appreciate having these surveys and formats to share what we do, because it keeps us, and then again, we have information that we can share and be transparent with our organization, so people really see the value, right? Because oftentimes when you do DE&I work, your audience or your organization may not really see the value of that. So I think there's a great value in participating.
Yeah, and it also sounds as if you have a culture of including the community already. So then when you need their information or insight, it's already there as part of your process. So
definitely.
Good.
I mean, we could always do more. I'm not saying it's, you know, nothing is complete, but absolutely we do have that reflected. And that's part of our core thinking, making sure we're speaking to our communities, even as it relates to vendors, right? So working with vendors, we've done a lot around that in our supply focus, understanding and working with our vendor community in a very particular way to bring them in to work with us. So very, very specifically hearing their voices.
Right. Dr. Gregory, can you talk about how you were able to include your CEO and other leaders around the work?
Yeah, so we've talked a lot about diversity, equity, and inclusion, because it really is the foundation for the health equity work. And one of the things that we say at Novan is this is not a program. It really is a culture change strategy, and it starts from the top. So in all of the work that we do, we really have sponsorship and ambassadors in our CEO, Carl Amato, and our board. It's built into the fiber of even our meetings. So at our Safety and Quality Council Committee for the board, we present health equity and health equity initiatives so that it's a constant conversation amongst our executive team, our senior leaders, and our board about the work that we're doing, how we're connecting to communities, why it's important to have community engagement and community voice, how that gets interwoven into the work that we do. And honestly, we're held to a high standard. If we talk about an initiative that we've co-created with each other or with the community, they want us to come back and share the progress and the successes that we've made. They want to participate in recommendations when we identify opportunities or we're struggling. Most of us in this room know that health equity is not a light switch. It doesn't just turn on and become in existence overnight. And we need that senior leadership support in the work that we do along the way. So not just for the application, but just as a continuum of conversation with our senior leaders. One of the things that we have is something called a long-term goal, where compensation for our senior leaders is connected to health equity. We've said as an organization, this is so important to us that we're willing to be all in to work towards advancing health equity. So from a personal and professional connection from the very top of our organization, we are connected in the space around health equity.
Great. Dr. Brooks, in kind of our final minute or so here, can you, and I'll maybe ask the others of you as well, can you point to one kind of policy or practice change that came about or is highlighted as a result of your engaging in the application process for the Equity of Care Awards?
Well, I think, it's hard to say one, because I think there is a confluence of things that are happening with its CMS, indicating that there's the need to document social needs, that our population health teams are now assessing social needs in high-risk communities, that our dashboards now have outcomes for, previously had outcomes for COVID by different demographic characteristics. We've included press gaining in some of the respect for race, culture, and religion. We have diversity, equity, and equity dashboards that include race, ethnicity, and gender. So I will say that and oftentimes people can conflate, health equity with regard to pay or with regard to hiring practices. So I do think it's created an opportunity to both talk about both and how it's important to have both. And you can have strategies that the strategies may be different, but they're all in service of working and helping to elevate the assets in the community, helping to amplify underrepresented communities and help them with more economic sustainability. And so I don't think that prior to these types of awards that allow you to have more conversations, that you have very many forums to talk about all of those things. The real estate people are doing their thing. The minority vendor supplier diversity, they're doing their thing. We're doing our thing. The folks in the hospital, I'm also in the hospital, so we're doing that thing. So, but I think we need to all be seeing how everything ties together in terms of really, having a more focus on equity and health equity in all policies, if that makes sense.
Incredible. So I'd like to thank you all. This has been, I could spend like another hour asking you all really good questions and getting this kind of insight. And I think for our audience, or those of you who are considering applying for the awards, you see, I think, in the talent and the thoughtfulness and the leadership that we have in the screen, our previous winners. You really see the commitment to the work, and hopefully you see how expansive and I'll end on this notion of equity within all. That approach is really I think a winning approach. So for those of you who are out there, these are kind of our leaders in the space. If you want to actually have more opportunities to speak about or commune with each other, I would invite you to join our Health Equity Influencers Roundtable. And there you'll have the opportunity for professional development, moral support, and more networking, if you will. So without further ado, I want to thank you, give you a virtual applause, say thank you for this opportunity to spend some time with you and learning more about your work. Look forward to kind of hearing more and reading more as you all go along. And I'm going to turn it over to Krista Meekins, who will speak a little more about the award categories and application process. I do see some hands for questions, and we have a period for about 15 minutes of questions towards the end.
Leon, can you take a minute or two to talk about the Llm Faculty Influencers?
Okay, so the Health Equity Influencers Roundtable, what I mentioned, is part of this work, which we would like to, again, offer professional development opportunities, primarily virtually. We have some networking events. Last year, we've held them at the Leadership Summit and the Accelerating Health Equity Conference, which you'll hear more about later. And that group is really our attempt to bring more people together who are in places of advancing equity, whether they are by role, meaning, or title, meaning the chief equity officers, chief diversity officers, things of that nature, or by kind of task. They lead a committee or kind of directing some of the equity work. And because not all of our hospitals have C-suite level roles, but we want we want to create a place where, particularly for this moral support portion of the work, where our members and those across the country who are doing this stuff can have a safe place and learn from each other. So again, I think there's a link in the chat for those of you who want to sign up for that. Krista?
Thanks, Leon.
Sure.
Okay, so let's get into our new award categories. So these are the 3 categories that we are transitioning from the previous award to this year's award. So the first one, we see the Equity of Care Award Transforming category. This recognizes a hospital system that is implementing strategies to influence equity in the surrounding community ecosystem. We also have the Equity Care Award Emerging category, which recognizes a hospital that is leveraging the Health Equity Roadmap resources to dismantle structural barriers in their care delivery system and the communities that they serve. And then finally, we also have the small/rural hospital excellence category, which recognizes a hospital or a system that has demonstrated excellence in advancing health equity in rural or small communities. And if you have any questions about these categories or anything that I'm speaking on right now, can you please enter them in the chat and then we'll address them at the end. So the application process, so in order to apply for an award, a hospital or health system, they must be an AHA member in good standing, and they must have registered for the Health Equity Roadmap and completed the Health Equity Transformation Assessment, or we call it the HETA, by the time of application. And so there will be a few links in the chat to these respective areas, so the Health Equity Roadmap and also the Health Equity Transformation Assessment. And so for the application process, applicants will choose one award category that best describes their organization, so transforming, emerging, or small/rural hospital excellence. And depending on which application category that you choose, you will choose the corresponding number of levers of transformation. And of course, once you actually see the application, you'll know what this is talking about. So it's listed in the application per category. This is the website that also will take you to some of this Health Equity Roadmap work, and then also the HETA as well. And then applicants will provide 2 narratives for each lever chosen. So a narrative on the Health Equity Roadmap alignment regarding whatever lever that is chosen, and then also a narrative on innovation in health equity, whatever your organization is working towards or has achieved. And so just to give you kind of an overview of the application timeline, we are going to open the application on September 26th, and it will close on November 18th. So it kind of gives you an overview of the timeline. We will notify award recipients and all other organizations that apply. We'll let you know sometime in May, is usually towards the middle or the end of May. And then award recipients will be recognized at the 2023 AHA Leadership Summit. And I will turn it over to Ogechi to talk about some other work that we're doing and that Leon also touched on.
Sure, thank you, Krista. So I'll take a minute to talk about our Health Equity Innovation Summits. And these summits are regional summits that essentially is for participants to create solutions for health equity that could be scaled at their regional level using the Health Equity Roadmap as a guide. And we have 9 regions, and by the end of this year, we would have completed 3 regional summits, and then we also have the following 6 scheduled for next year. So these summits target, for our main audience, we target the C-suite level. So we're targeting CEOs, COOs, CDOs, also health equity influencers, community stakeholders, and also patient advocates. And based on the discussions and ideas, regional solution briefs are created for the hospital at that region. And it's also going to be used to advance health equity, diversity, and inclusion. And so this is a really good networking and collaboration session for hospitals and health systems that want to, advance their DE&I work. So the next slide, please. So our next upcoming summit is in St. Paul, Minnesota. That is October 10th of this year, and the registration deadline is October 6th. And so our Region 6 hospitals include, North Dakota, South Dakota, Nebraska, Kansas, Iowa, Missouri, and Minnesota. So if you live in any of these states and you are essentially at that C-suite level, or you are, as like I said, a health equity influencer, a community stakeholder that does the D&I work, or pretty much advancing health equity, or you have colleagues, anyone in your network who, you could think that could benefit from participating in these events, like please spread the word. The link is here in the slide deck, and we will also send out a follow-up email with the slide deck and the link to register for our Region 6 Summit. That is all from me. Thank you.
Thanks, Ogechi. And so just to wrap up with some of the other work that we're doing as well. So we have the Accelerating Health Equity Conference. That will be next year, May 16th through 18th in Minneapolis. Our theme for this year is Together on the Quest for Healthy Ecosystems. We are playing this conference along with the AHA Community Health Improvement Team as well. And so I'm going to show you that our call for content is open right now. It opened a couple of weeks ago, and it will close on the 25th of this month. And so we are welcoming any submissions from the following content areas. So building authentic and sustained community engagement and partnership, understanding and meeting individuals' health and social needs, establishing systematic and shared accountability, and building diverse leadership and governance, creating equitable and inclusive workplaces, and then other emerging topics, so maternal and child health, behavioral health, violence prevention, anything that you really don't think that will fall under these other categories, it can fall under the other emerging topics as well. So we encourage you to head to our website, equityconference.aha.org, and you can hit the speaker opportunities tab, and it will take you to our call for content submission. And I am going to wrap up with any questions that you all may have. I'm going to check the chat as well, just to see. All right.
See, Tony Coleman has a hand raised.
Okay.
Good afternoon, everyone.
Good afternoon.
Okay, good. You guys can hear me. So I'm the president and CEO of Broad Lawns Medical Center in Des Moines, Iowa. We're a safety net hospital. I'll just say diversity, equity, and inclusion is central to my leadership strategy, and it is a personal passion that I have. So I really appreciate all that the American Hospital Association and the Institute for Diversity is doing to forward this cause. Really one quick question that's geared towards the award recipient from 2023. Just wondering if there was an opportunity to build a networking connection and maybe view or have a conversation about your health equity strategies in greater detail. Here, we're building out our strategic plan, and it's 4 pillars. The 4th pillar is DEI, and I have an inaugural Chief Diversity, Health Equity and Inclusion Officer that's helping further that work. But I would love to have some other ideas from organizations and systems that are further along in that journey. So if there's an opportunity, I'd love to partner or at least have a conversation with one or all 3 of those systems.
I think you have Dr. Gregory responded pretty quickly. And I'll say we have a couple of opportunities as well for those of you who engage in the health equity roadmap. We do have we're putting together what we're calling the journey. And the journey is a virtual community. And that virtual community are those hospitals and systems that are engaged in the roadmap, putting the pieces together, can ask questions much like Tony, you just asked, and has access to each other in kind of a real formal virtual way. So look for that. For those of you who are applying, and you will register for the roadmap and complete register for the roadmap and complete the health equity transformation assessment. That is one of the products of that process. But it looks like you have some, at least Dr. Gregory has offered.
Yeah, I see that. I appreciate that. Thank you.
Yes.
I think everybody put their email in there, so. I'm gonna have to run, but this has been excellent. Take care, everybody.
All right. Thank you. Thank you for your time.
Yeah.
Any other questions?
Yes, this will be recorded and sent out to everyone.
I have a quick question, if you don't mind. I'm part of a clinically integrated network of outpatient serious illness agencies, mostly hospices, palliative care, home-based primary care. We interface with many hospitals, various health systems across our state and our geographic region as a whole, but we're not part of the hospital. Do you have any, would you point me in any directions for that kind of community rather than hospital service? Because this is something that we are very, very passionate about and want to weave this into the very fabric of our agency. And because we're a clinically integrated network, we have the opportunity to, have our quality standards be required for every member in our network, but every member agency. And so we're poised to be able to bring this to a large area. And so we want to make sure we're doing it well. We want to stand on the shoulders of those who have done so much work before us and then lift others up. So I'm just looking to see how we might get started since we're not a hospital system.
Yeah, I would invite you to visit the National Association of Community Health Organizations, NACHO.
Okay.
As well as the Institute for Health Improvement, IHI. They have really solid resources. We're in partnership with both of those organizations.
Great.
So we share a kindred spirit and, kind of zest for doing the work.
Fantastic. Can you repeat the first one you said?
The National Association of Community Health Organizations, NACHO.
Thank you so much. That is incredibly helpful.
Mm-hmm. I should note that both of the IHI and NACHO are partners in a pillar around equity in systems. So I feel confident that us referring you to them you'll get what you need out of that.
Perfect. Thank you so much. I was so impressed with your website that I just wanted to come to this webinar. So
excellent.
Thank you so much.
Any additional questions in the chat?
I don't believe I see any more.
Okay. I don't know if Dr. Gregory or Ms. Abner, if you have any kind of final thoughts or words of encouragement to any of our prospective nominees, if you will. Anything you'd like to share?
Maybe just a comment. I love that you are sort of widening the lens and being really inclusive for health systems and hospitals that vary in size and mission. I think this application is one of those things where it helps us to understand the work that we're doing. So even for health systems that may be early in their journey and have just one really unique thing that they want to share with your organization, I think that it's a real opportunity to gather the folks that are in the health equity space, whether you're a team of 1, 2, or many, and have this conversation. So I appreciate that you have been additionally inclusive in who might be able to apply.
Thanks. Our team is we're really supportive of the range of membership, and we really want this work to carry on.
I just have one clarifying question, if I may. This is Shauna Lee. Hi, from Mainline Health in the Philadelphia region. I am curious about the new categories of the award. Dr. Caldwell, as you know, Mainline Health is a health system of 5 hospitals. And I'm curious about the selection or the requirement to select one award category and the categories being hospital-based. If you can provide some clarity there so that I can better approach which category to select as we pursue these opportunities.
So the thought process is the transforming is really a systems award. So Mainline would be in that category if it chose. Emerging is at the hospital level, right? So we want to kind of give people the opportunity to really say one hospital in a system, or if you're just a one hospital organization. We didn't want to, wanted to be inclusive, I think as Dr. Gregory mentioned. So for Charlie, I can imagine that the decision can be made as it Mainline the system and all of its 5 hospitals can talk about its work in that category and answer that narrative? Or is there one hospital within the system that you like to put up as doing some really, some progressive work that meets the needs of the criteria?
That's very helpful. I'll go even further to ask one more. Will health systems or organizations have the opportunity to submit 2 applications? So not just either or, but both.
In a category, if it's in the emerging category, if you wanted to put up 2 hospitals to kind of compete against each other, great. If you apply for the systems, it's an either or. We've at least for this year until we get more feedback, we're going to have at least one of the 3 that you can apply for.
Thank you. That's very helpful.
Mm-hmm. Any additional questions?
Hi, this is Tony Coleman again. No questions, just a moment of gratitude for the recognition of this work with AHA. I was talking to Ms. Priscilla Ross earlier today, and I just want to say how grateful I am. I came to this job 8 months ago from Los Angeles, California, and I think people kind of looked at this guy in Des Moines, Iowa, talking about, walking up in here talking about diversity, equity, and inclusion. They kind of looked at me sideways. But I can't tell you how good it feels to read the AHA newsletter and read Wright Lassiter's words talking about how diversity, equity, inclusion must be embedded into the work that we do. It served as kind of a validation for what has been my life's work and what's my passion. So really just a moment of gratitude. And when I joined this call and saw 42 people, and now it's 50 some people, that again kind of solidifies my passion and helps me realize that we're on the right path here in Broadlawn. So thank you guys.
Thank you, Tony, and best wishes to you and with your leadership of that hospital. So Rose Bailey asked, please expound on the award categories and HEDA being hospital focused. So the Health Equity Transformation Assessment that's designed for local input or at the hospital level. We do know that, and we're working on what we're calling a Health Equity Transformation Assessment Systems Assessment. It's the same assessment, but we're going to pull out questions that can be answered at a centralized office or from a system at a systems level. But we firmly believe that the work of equity, health equity, is a local challenge or a local opportunity, in that even across large systems, there may be variability in context of demography or geography that should be accounted for when putting resources to advance equity. So this whole idea of the notion of equity within equity is important. So for that reason, we've kind of anchored our work on really focusing in on at the hospital level. How is equity being advanced? How are hospitals embracing the 6 levers of transformation across this continuum of transformation that we have developed? So thank you so much for your time on behalf of the Institute for Diversity and Health Equity.